What are some of the things that you do with your patients if they do have a chronic cough?
So we certainly encourage them to come in and see the physician. We do take a careful history, which can include asking about any recent illnesses, if there was a cold that may have provoked this, if there were no colds to provoke this. And then depending on what the history and exam shows, we may order imaging like a chest x-ray. We may try a prescription for an antibiotic or an allergy medication or even a reflux medication to figure out if we can try and understand what's happening with the cough.
Now, what about respiratory problems? Because how does that lead to maybe finding if a patient does have some other sort of respiratory issue?
What do you mean?
If they have a cold, is there anything else that maybe can indicate there's something a little more here, something going on in the respiratory system?
Yes, so that is something that with that visit and ordering imaging will help us determine. So for example, if somebody comes in and we're concerned that this just doesn't seem to match a diagnosis of a bronchitis or asthma or allergies, we may utilize a specialist like a pulmonologist to help us investigate further.
Great. Now, allergies, and for most people, allergies are not severe, and other over-the-counter medications are sufficient to deal with occasional flare-ups of sneezing, watery or itchy eyes, and runny nose. But how do you help patients with allergies? I know that a lot of times you go for an allergy test. So when you see a patient, what's the first line of defense?
So we, again, take a careful history to find out exactly what is going on with the symptoms, if there are known triggers. And then we do usually discuss allergy precautions. So one of the things that allergists will frequently recommend is making sure that the air conditioning filters have been changed or cleaned.
I learned that one. I did it when I moved to South Florida, but back again, the air filters are so important.
Yes, they are so important. And a lot of times patients who have ceiling fans don't realize that those ceiling fans do need to be dusted, and also keeping the space around where you're sleeping to be dust-free as well. Changing pillowcases. Dust finds its way everywhere and can certainly trigger allergies.